Hi there. In this video, we will discuss guideline-directed medical therapy or Gdmt for heart failure with reduced ejection fraction. You will learn the risks of heart failure, the benefits and process of starting medication therapy. We will also introduce the heart failure medication score that is displayed on the Gdmt mobile application dashboard.
30 years ago, before effective medications were available, patients with heart failure with reduced ejection fraction had over a 50% risk of dying in the next 5 years. Most patients were frequently hospitalized due to their heart.
Fortunately, we now have a combination of effective medicines that can stop the progression of the disease and even make the heart stronger. Your heart's ejection fraction can increase and even go back to its prior level. Even if your heart does not get stronger, these medicines can still help you feel better and live longer.
There is not necessarily a single effective medicine for a given person. Instead, 4 different types of medicine work together to reduce risk.
The 4 classes or types of Gdmt medications include 1. Beta blockers. 2. Renin-angiotensin system inhibitors that include ACE inhibitors, ARBs, and sacubitril/valsartan. 3. Mineralocorticoid receptor antagonists. 4. SGLT2 inhibitors. Each medication class is discussed separately in another video. Each type of medication on its own has been shown to lower the risk of death for patients with heart failure. In combination, these 4 drugs are estimated to lower the risk of death by over 70%. They also help people feel better and be able to do more activities. A major goal of heart failure treatment is to take the best possible combination of medicines for you. Different providers have different approaches for starting and changing the medicines. Though the order may vary, getting on these medicines early is important in lowering your risk of hospitalization or death. After you start taking these 4 classes of medications, your clinical team will try to increase the dose of your medicine over time. This is because there is a goal dose that has been shown to offer the most benefit to heart failure patients. Heart failure medications can be safely adjusted by your care team every 1 to 2 weeks. With each adjustment, your clinical team will ask you to monitor your blood pressure, heart rate, symptoms and, often, labs. If you experience side effects, do not stop your medication. Reach out to your clinical team for their recommendations. Some patients will not tolerate getting to the goal medication dose because of side effects. That's okay. These patients will still have benefit at a lower dose. The Gdmt app includes a personalized heart failure med score to help you track where there are opportunities to improve your medicines. This score ranges from 0 to 100. A score of 50 means there is a lot of opportunity to lower your risk by working with your care team to increase your medications, while a score of 100 indicates you are on the best possible treatment for your heart failure with the 4 medication classes discussed before. The med score rewards points for being on a given medication class and additional points for being on a higher dose. If someone cannot take a given medication due to a side effect, the score is not lowered. You can still reach a score of 100 when medication increasing is prevented by side effects. There are other medications that you may be taking to help your heart that are not included in the Gdmt app, including hydralazine, isosorbide dinitrate, blood thinners, and antiarrhythmics. Continue to take these as your doctor prescribes them. Loop diuretics, or water pills, are also important medicines for heart failure care for some patients. They do not help the heart get stronger but do help with fluid buildup and symptoms. These are discussed in another video. Heart failure is a severe condition, but we are fortunate that there are now effective medications that decrease the risks of bad outcomes and increase the chance of heart muscle recovery. The Gdmt app is designed to make it easier to get on the best combination of medicines that aim to help you live longer and healthier. We hope this video has been helpful. Should you have any questions, please reach out to your care team.